Wonderful. So, good afternoon, everyone, and welcome. We're so glad you've joined us today. Whether you're calling in from a rural community, a state office, or somewhere in between, we appreciate you taking the time to be part of this conversation. So, I'm Alicia Frericks, and I serve as President and CEO for Lutheran Services in America. If you don't know, Lutheran Services in America is a nationwide network comprised of 300 health and human service organizations and over 1,400 communities, with a mission to cultivate caring communities that advance health and opportunity for all. Today's webinar, From the Ground Up, Using Rural Voices to Build Better Policy for Aging Americans, will highlight the power of listening deeply and intentionally to the lived experience of older adults in rural communities. This listening is in service of creating better solutions for those older adults, their caregivers, and the organizations that serve them. This work is grounded in our recent report, Rural Voices Shaping Transformation, which was developed in partnership with the SCAN Foundation and the Public Policy Lab. Over the past year, we traveled to rural communities across Minnesota, North Dakota, and South Dakota to hear directly from older adults navigating the intersection of Medicare, Medicaid, housing, food, transportation, social connection, and health. At its core, this work asks a simple but critical question. How do we go beyond the data to understand what it truly looks like to age in rural America today? Not just the challenges, but also the workarounds, the resilience, and the community strengths that too often go unseen in traditional policy conversations. And I think we all know this moment is urgent. Nearly 14 million older adults live in rural America, where structural barriers from long distances to care to limited workforce and transportation options can make it significantly harder to access the supports needed to age with dignity and independence. At the same time, these communities are rich in social connection, rich in innovation and resourcefulness, assets that must be part of the solution we design. Today's conversation will explore what we heard from older adults, why centering lived experience matters alongside rigorous research, and how these insights can help shape more responsive, equitable systems of care. You'll hear perspectives from our partners on how this work was conducted, what themes emerged, and most importantly, what this means for policy and practice at the federal, state, and the community levels. Whether you're a policymaker, a practitioner, a funder, or a community leader, our goal is that you leave today with a clear understanding of what human-centered, community-informed policy can and should look like, and how each of us has a role to play in building it. So before we begin, we'd like to gauge your understanding of this topic with a quick poll question. And Kylie, I think you're going to put the poll up for everyone. What do you see as the biggest challenges facing older adults in rural communities today? Kylie, I think when we're done, you'll share the poll. Let's see, is she sharing it? All righty, so lots of responses. Healthy nutrition, about 10% of you say is one of the biggest challenges. Safe and affordable housing, 21%. Transportation, those long distances, 28%. And access to quality health care, 41%. We've certainly seen those stories and those resources disappearing in many cases from rural communities. So now it is my pleasure to introduce our partners in this work and today's speakers. So we have Nardia Ipakchi. She serves as Vice President of Policy and Programs with the SCAN Foundation, and P.D. Rautzahn, who's the advisor with Public Policy Lab, as well as Sarah Haight, who serves as VP of Programming, Planning, and Growth at Lutheran Services in America. This work is possible because of the partners who believe deeply in elevating lived experience in aging policy. I'd like to now turn it over to Narda, who will, with the SCAN Foundation, to share why this work matters. Narda.
Thank you so much. And I'd like to start by thanking Lutheran Services of America for their partnership and leadership in this incredibly important body of work. I'd also like to especially thank the local LSA representatives who worked with us to help identify, recruit, and support the participation of older adults in Minnesota, South Dakota, and North Dakota for this project. We're at a pivotal moment in how we think about aging in this country. The decisions being made right now at the federal level, state, and local all shape how millions of older adults experience care and will for decades. So at the SCAN Foundation, we are really focused on centering the voices of people who are often left out of policymaking, those with lower incomes, people of color, and those living in rural communities. And that lens really guides us in how we direct our resources and what we prioritize in our policy-focused grant making. So we don't work on behalf of older adults. We really make sure to hear from them directly because their experiences and perspectives should shape the work and the policies that we aim to influence. And we think that approach is incredibly important in today's environment, especially when data and evidence we've seen is not enough to move the needle. And that's why just over 3 years ago, the SCAN Foundation, in collaboration with the Public Policy Lab, created the People Say, which is an online, publicly available research hub featuring firsthand insights from older adults and caregivers on the issues that matter the most to them. This platform documents lived experience right now of over 140 older adults in 15 different states with the healthcare system. Many of those older adults are folks from rural communities across the country, and you'll get to hear from some of them on the platform soon. At the end of the day, we know that in any policy conversation, policymakers need to hear from real people, people who live the policies that are being debated. And that's what we're trying to amplify. And this is especially true in rural communities where older adults in particular face unique challenges that those in urban settings might not. For example, and as we saw from the poll, many older adults have to travel really long distances to receive basic care. Rural communities also face persistent challenges when it comes to things like hospital closures and reduced access to care infrastructure, workforce shortages, very high rates of poverty, sometimes among older adults, and limited access to long-term services and supports, particularly those that are provided in home and in the community. So if we don't actively elevate rural experience, we risk continuing to have systems that don't fit the communities and older adults that they're meant to serve. So we must also be focused on systems level and incremental changes to advance the needs of older adults in rural communities.
And I
Thanks
think,
so much, Martha. Petey, we're going to turn it over to you. I think you were just jumping in.
yeah, now we're going to play a short video from the People Say from older adult participants from Minnesota, North Dakota, and South Dakota. And then I'll explain a little bit more about our process and how we captured these videos and how this data can be used. So as I share my screen and play this video, if I could just get a thumbs up when the audio starts to make sure that everyone can hear it, that would be great.
I know the only thing I'm lacking as far as assistance from Medicaid and Medicare is my vision, my hearing, my teeth. I've got 8 teeth in my mouth, and I've pulled every one of my own teeth because insurance just don't cover it, and it should.
No, Medicaid can cover some, but Medicaid can't even say cover all. Mm-hmm. Because certain medicine they have to buy from my pocket. If I can't get the cash, I can't get the medicine from the same salary.
But I don't want to go live on the Fargo side. I want to stay in Minnesota. From what I hear from other people, that their medical coverage ain't all that great in North Dakota, like Minnesota. Everybody said Minnesota has better health care. And everybody's trying to come to this side that lives at all the homeless people that I know, they're trying to come live on this side. But it's hard to find a place to live for them.
Actually, South Dakota for their Medicaid is a little bit more lenient than some states. I know we've talked when I talk to LSA, Oklahoma says they can never have more than $2,000 in the bank. South Dakota says three. So, there's a little bit more wiggle room. I think once they get applied, they have no problem accessing services, but getting approved can be an issue, especially farm families, because you're looking at tens of thousands of dollars worth of equipment, which will make you ineligible, that you no longer use, that's sitting in the barn. Some of these, a tractor will cost you more than a house, but it doesn't do you any good when you're hungry or you're cold or you need in-home care.
And if they take that away, there's going to be a lot of them that's going to be hurting. And how are people like this going to be able to afford their doctor's appointments, their medication, or whatever? That's not a good idea. I don't agree with that at all.
So that was just a few minutes of clips from the People Say platform, and specifically for these interviews that we conducted with Lutheran Services in America. And just to take a step back and introduce myself, my name is PD Routson, and I'm a project lead at the People Say. And as Narda had mentioned, the People Say is a collaboration between the Public Policy Lab and the SCAN Foundation. So for this project, we traveled to these states to conduct interviews with older adults around a few areas of inquiry that Lutheran Services in America was particularly focused on. As the project lead, I conducted many of these interviews and then helped design the platform that houses all of the qualitative data from older adults. So that was just a short snippet, maybe 2 minutes from over 200 hours of interviews with older adults that are housed on the platform. And I'll spend the next few minutes going over how we gathered this data and then how it can be used. So just kind of starting with the problem that we're trying to solve with conducting this type of research and these in-depth interviews with older adults is that policy and systems for healthcare and aging are designed from the system perspective and by policymakers rather than with and by older adults. So we address this by focusing on priority populations that are often left out of research. So that's people of color, people who are low income, and then people living in rural or medically underserved areas. And then next, we capture that lived experience of older adults and we tag it according to a taxonomy that references existing research. So when we tag all of our data units on the platform, we're looking at notable quantitative studies. So if you're a policymaker, that's often referring to a few different studies to inform different policies and system decisions. We use those same terms and then provide this rich lived experience video data so that you can kind of understand how that quantitative data is experienced day to day by older adults. And then lastly, we're naming the urgent need to engage in system and policy changes for older adults and kind of provide a framework to do that. The People Say contains 3 primary elements. So there's this research pool of the older adults, including caregivers and staff and subject matter experts. And this pool grows every year. So every year we go out into the field and conduct more interviews. Next, there's the research data. So on the platform, there's over 4,000 data units. You saw maybe 4 or 5 in that video, and that's out of about 4,000. And then those were collected from over 200 hours of interviews. So each interview with an older adult can last up to 90 minutes. And then all of that data is tagged per a taxonomy that policymakers and system leaders are already using to make policy and system service design decisions. And then lastly, there's the online platform where you can actually interact with this data. So in the database, you can search and filter by different topics. You can look at participant profiles, which is a deep dive into each one of these participants to learn all about their demographics and see all of their data units in one place. And then there's the insights for action, which are the things that bubbled up naturally in conversation with older adults across all locations. And then more about this specific partnership with Lutheran Services in America. So up in the middle right, you'll see these 3 states highlighted. So the People Say contains data from all of the states that are shaded here. And as I mentioned, we're continuously growing. But for this project, we traveled to Minnesota, South Dakota, and North Dakota and talked to a handful of older adults there around a few areas of inquiry that Lutheran Services in America were focused on and wanted to learn more about for this report. So that's what is the experience of dually eligible older adults in these areas. What are the experiences of rural older adults in these areas? Um, and then lastly, how do older adults use different supportive services to help them access services or age in place? So that could be faith-based services like things that LSA provides, or things like home and community-based services. So as we went into the field in these locations, we were focused on those three primary questions. And then these are just some snapshots from our trips to those locations and the interviews themselves. So we travel in teams of in pairs of researchers, and we conduct these interviews with older adults either at their homes or community centers. And while we've conducted research in rural areas before, these areas were unique for a few reasons. The location in South Dakota in Lake Andes was very rural. So we flew into the Sioux Falls airport and had to drive about 2 hours to get to the location. And then the town itself only has a few hundred people. There's only one bus that goes in and out of the city or of the town every day. So housing, jobs, things like that, they're in low supply. And then another thing that was unique about these locations is that we originally set to travel to Minnesota, but we were in a border community between Moorhead, Minnesota, and Fargo, North Dakota. So we talked to older adults in both states, even though those two locations kind of operate as a single community. Because they're different states, there's different Medicare, Medicaid policies, and eligibility requirements and availability of services are different, which one of the participants highlighted. And then here's a snapshot of the older adults that we talked to in these locations. So we talked to 17 older adults in total. 15 of those older adults were below 138% of the federal poverty line, which is a marker used for Medicaid and other social service eligibility. 14 of those older adults were dually enrolled in both Medicare and Medicaid. 12 were rural residents. 9 were home and community-based service users. And then 7 were people of color, Latino or Latina, or American Indian. And then you can see below snapshots of each of those participants. So all the folks you see here, they have a corresponding profile on the People Say with about 15 to 30 video data units each of the older adult talking about accessing healthcare, applying for Medicare and Medicaid, and things like that. And you might say to yourself that this sample size doesn't look very large. That's because when we're doing this human-centered research, we're really interested in thick data. So that bar you see on the left called big data is what we are often seeing in quantitative studies. It's a large sample size, and you're talking to maybe thousands of people, but you're not collecting very deep insights. With thick data, we have a smaller sample size, but we're going very deep in these interviews and really learning the kind of the mental models and the beliefs behind people's experiences and decisions. So this is sort of what traditional research often misses. With larger quant studies, you might get sort of, you're just tapping the surface and you're learning people's opinions. You might see patterns between participants. But then with these deeper interviews, what you're really getting at is some of the underlying structures and the mental models and the beliefs that inform people's decision making day to day. It's really, it's like we're going to the older adult and sort of shadowing their day to day and understanding how they're navigating some of those things that we brought up in the poll, how they're navigating transportation, access to nutrition, the ability and availability of medical services and whatnot. And then how do we capture this lived experience? How do we really get this thick data? So each engagement with an older adult can last up to 5 to 6 hours. And then this is just a little timeline of what it looks like from the older adult's perspective. And they're paid for their time, about $50 an hour. Um, and I'll dive a little deeper into these things now. So the first way that we capture lived experience is working really closely with community-based partners. So Lutheran Services in America has frontline staff that operate out of senior centers and libraries in these areas. We worked really closely with those staff to identify members of the community that would be a good candidate for this interview. So people who are using Medicare and Medicaid, who are struggling to get the help they need, older adults who may have transportation issues. So they really brokered those relationships, which really helped us because building that trust can take a long time. We have done kind of cold outreach in locations before trying to reach older adults, but working really closely with people that were already embedded in the community meant that we already had that trust and then we're able to get these rich insights from older adults. And then we conduct semi-structured interviews. So as I mentioned, these interviews are about 90 minutes long, and we're sort of shaping the interviews around those inquiry areas that I mentioned, the experiences of being a dual, experience accessing healthcare in rural areas, and using supportive services. But because it's a semi-structured interview, we're also following the lead of the older adult. What are the things that they're bringing up? What are the things that matter to them? How are they experiencing policy day to day? So we really let the older adult sort of guide the conversation and lean into areas where they have a lot to say, and then might glaze over things that they might not know a lot about. The other tenets of capturing lived experience are participatory and ethical research methods. So as I mentioned, the older adults are helping guide those interviews, but then we're also leaving them with a few independent activities that they're able to do in their own time with more reflection. So we have an activity called My Life Timeline, where the older adult scribes out all of the important factors of aging, like retirement, different family milestones, like when they may have kids or different health milestones. And then they send that back to us and that gets put onto the platform. And then lastly, the older adults are reviewing all of the data before it gets published. So on the right, you see a snapshot of a participant profile from one of our participants from South Dakota. We share this photo, the alias that we choose, and all of the data with the older adult before it gets put onto the platform, and they're able to redact anything that they don't want on the platform. If they're tech savvy, we send it over email. If they're not, we'll send a printed package in the mail that they can send back to us with annotations and things crossed out and whatnot. And then once the data is published, we also allow older adults to remove things if there's things that they don't want on the platform any longer. And then a quick example of how do these conversations generate insights for policy design. So on the left, you see a breakdown of how many minutes our participants in these locations spent talking about different topics. So you can see an average of 15 minutes were spent per interview on receiving help, an average of 8 minutes spent on talking about fixed income struggles. So this is quant research. This is saying these participants spent this amount of time talking about this thing. It identifies some of the problems they're facing, but doesn't really explain why. And then on the right, you see a quote from a participant that says, every year, every time I get a raise in Social Security, they raise my rent. And then my food stamp allowance goes down. And it's just like a roller coaster with my finances in the beginning of the year. So here we're seeing that Social Security might go up a little bit, but then their rent goes up and then their food stamps go down. So an insight that we can pull from policy here is that food stamp allowances should reflect the cost of living and not necessarily a small increase in Social Security. Many older adults said that food stamps used to cover their needs, but in the past few years with inflation and a rising cost of living, they don't cover their needs anymore. And on top of that, some of these allowances get decreased every year with small increases to Social Security. And with that, I will hand it over to Sarah to talk about some of the insights that we heard out in these interviews and what that means for policy and practice.
Thanks so much, Petey, and thank you for all of that detail on the process and the engagement. It was a really powerful process for LSA, and we can talk more during the Q&A about some of what Petey shared. I first want to just start out by acknowledging a colleague of ours who's not able to be with us. Reagan McManus, who is LSA's Director of Aging Initiatives, has been one of the architects of this work for LSA. She's been a thought leader and someone whose ideas and hands are on everything that you're hearing about. She's not able to be with us today, so just wanted to acknowledge all of the work that she has done on this project. I also want to note that I'm going to be sharing, as PD said, some of what we heard from the older adults and then talk about some of the policy and practice implications. We have deliberately built in time for Q&A. We have an incredible group of participants here. Geographic diversity is really striking to me, from Florida to Utah to Chicago to the Dakotas. So please feel free to start dropping your questions in the chat. When I've finished up giving some of my remarks, I will look at those questions and LSA will respond to them, but PD and NARDA are also here to respond. So I think you're sensing some themes here already, but what we heard throughout this project is both clear and urgent. This is a population with some of the most significant health, functional, and social needs, yet they are often asked to navigate two separate systems with different rules, requirements, and processes. And that complexity can create real barriers to accessing care and support. And in rural communities, those challenges are really compounded with limited provider availability, long travel distances, workforce shortages, gaps in transportation and broadband, all of which make it harder to get the right care at the right time. And yet, I think what stood out to us just as strongly in these conversations was not simply the challenge, but also the resilience. So older adults are not just the recipients of care. They are anchors in their communities. They are caregivers, they are neighbors, and they are trusted connectors who help sustain the social fabric of rural life. I think each of us on this webinar has an older adult in our life, either right now or in the past, who is someone who really represents the joy and the wisdom and the community knowledge that we're talking about. So what we heard clearly is that accessing basic services and maintaining independence while staying connected often requires extraordinary persistence. And I think what I'm going to share in terms of the 6 overlapping barriers that emerge highlight real gaps in our systems and also point to opportunities for us to be more responsive and community-driven in our solutions. And we believe at LSA that by pairing lived experience with data, this project can give us a fuller picture of what aging in rural America truly looks like, and just as importantly, where change is needed and possible. So I'm going to give an overview of 6 big overlapping barriers we saw, and you're going to see some quotes from different older adults that reinforce those barriers. What I want to note is these challenges don't happen in isolation. They kind of stack and compound, making it even harder for older adults to access the care and support they need. So the first one is really around Medicaid eligibility gaps. We heard very clearly that eligibility rules often don't reflect rural realities, especially for those connected to agriculture. We heard a couple older adults say to us that they are land rich, but cash poor. They may own farmland, but that doesn't translate into income they can use. And yet that land can disqualify them from Medicaid, creating an eligibility cliff that forces very difficult choices between keeping land, sometimes land that's been in their family for multiple generations, and accessing basic care. Second big barrier we heard is really around administrative burden. We heard that the system itself is often the barrier, a system that was designed to help people. This is not unique to rural older adults, but we certainly saw it loud and clear here. Applications, renewals, verification processes. These are complex and difficult to navigate. People aren't necessarily losing coverage because they're ineligible. They are losing coverage because the process is simply too burdensome. A third big barrier we heard about is broadband limitations. Many systems assume digital access, but that's actually not the reality in a lot of rural communities. Without reliable broadband, online portals actually become barriers instead of solutions. And this is where some of the institutional bias around accessibility comes into play. We heard very clearly from participants, phone and text-based options are not just a convenience, they're actually essential if we want to be as inclusive as possible of this population. The fourth big barrier we heard is actually the geographic distance, which is not that surprising, but is important to name explicitly. Distance is just a constant challenge. Services may exist, but they're often far away. So a 60-mile round trip for one appointment is pretty common. And in many cases, it's just not feasible, especially in winter, especially in rural places where winter lasts a very long time. So access isn't just about whether the services exist, it's about whether people can realistically reach them under the conditions that they're living. So the fifth big barrier we heard about, and I would just note this is pretty consistent across the LSA field right now, is around workforce shortages. So rural provider networks are pretty thin. Even when people qualify for services, there may not be providers available. That's not necessarily a reflection of the quality of those services. It's simply a reflection of the capacity and the size of those services. So rural workforce shortages mean that care just doesn't always exist in practice, even when it exists on paper. And this really highlights the need for more flexible community care models. That's something that LSA is exploring in our Rural Aging Action Network as well. And then finally, the sixth big challenge we identified is what we're calling the navigation deficit. People actually don't always know where to turn. So without trusted guidance, older adults may miss benefits they qualify for and fall through the cracks. So what typically works in rural communities are trusted local touch points, libraries, churches, community centers. We've learned in RAM that sometimes the local mechanic is actually an incredible resource for what kinds of services need to be accessed. These are not just community assets, they are essential access points. So I think taken together, these barriers show us that rural older adults are navigating systems that really have not been designed with their realities in mind. And then importantly, for those who are dually eligible for Medicare and Medicaid, which is the population we specifically elevate in this work, these challenges are even greater because they're navigating not just one, but two complex systems at once. As I said, what we heard wasn't just about barriers, it was about resilience. Rural communities are already creating solutions. So we want to take a moment to highlight where we see some of the opportunities and really underscore that elevating these voices is not just in service of making sure there's information about the gaps, but also that these voices are expertise and we can learn from them about some of the changes that are possible. So I'm going to transition now to just 3 policy areas that we highlight in this project. As Petey noted, this work is grounded in the lived experiences of older adults across rural Minnesota, North Dakota, and South Dakota, many of whom are navigating the complexity of dual eligibility. And as I noted, the limited access to services, workforce shortages, and the realities of distance play a big role. But these are really, really strong people and communities, and the deep community connections that they have really define their rural lives. So if you think about the 6 barriers that I just shared, I think the big takeaway is that if we want to build better systems, we have to design with them, not just for them. And I think that's where each of you on this webinar plays a critical role. Community organizations, policymakers, advocates. I see from the chat, the introductions, some of you are running big systems and services in states. Some of you are frontline staff. Others of you are thinking about broader policy initiatives. Each of you is essential in translating these lived experiences into meaningful change by elevating the stories, aligning them with data, and using them to inform decisions about funding, program design, and policy. So, guided by what we heard and where we see the greatest opportunity for impact, at LSA, we identified 3 key policy areas. The first is ensuring stable Medicaid access for dually eligible rural adults, older adults. The second is expanding and modernizing home and community-based services. And the third is really strengthening benefits navigation and supportive services and leaning into that community-based piece. So together, these 3 areas reflect both what we heard from participants and where we see real opportunity to create more responsive community-informed solutions. And in this final phase before we go to Q&A, which I'm just plugging again, so as you're listening to all of this, what questions do you have? Please put them in the chat. We want to shift from the insights we heard to action. So what are some of the tangible solutions that each of us can do next to turn these lessons into meaningful change? The first might sound simple and straightforward, but it's really important to underscore. Start with listening and keep listening. So create regular opportunities to hear directly from older adults and caregivers, listening sessions, advisory groups, short interviews. When we incorporate lived experience into program design, into funding priorities and policy development, we know that we learn a lot more, not just about what's working, but also where there are barriers. And often those barriers don't necessarily require a huge legislative change, right? They can be small administrative tweaks that improve the quality of life, both for staff as well as the communities we serve. The second is strengthening and expanding community-based supports. So I know many of you are thinking about this already, but really identifying gaps in home and community-based services in your area, especially with regards to transportation, nutrition, and in-home supports. Those 3 areas we heard loud and clear from the older adults were pretty big gaps. This could mean partnering across sectors, faith communities, local businesses, schools, volunteer groups. Where are older adults connecting with people? Build flexible community-driven solutions that meet people where they are. And that may look different in different communities, which is why these are principles and insights, but they're intended to be adaptive. The third is investing in navigation and trusted local connectors. And this is really a part 2 to what I just shared. So supporting or expanding benefits navigation through trusted community touchpoints, libraries, auto body shops, senior centers, clinics, faith-based organizations, and also exploring lower tech options. We live in a very high tech world, and it's important that we stay on top of that. But we also have to listen to what these older adults are telling us, which is that in many instances, they are phone-based, they are in-person based. So think about how to diversify how you're using technology to ensure access for those without reliable broadband. The fourth is around addressing workforce challenges more creatively. So building partnerships to expand the care workforce, community health workers, paraprofessionals, volunteers, other non-traditional roles. Thinking about how to partner to promote policies that support more workforce flexibility and allow providers to practice at the top of their license. The fifth is simplifying systems wherever possible. I know this is very, very difficult in this field, but taking a step back and looking at applications, forms, processes in your organization or state. Where can you reduce complexity? Where is there duplication? If you were filling this out, would you be able to do so? I think that's often a good exercise for you and your staff. Clearly communicate eligibility and benefits in plain language to reduce confusion and barriers to access. And then the sixth is using your voice to elevate rural perspectives, sharing stories and insights from your community with policymakers, with funders, with other partners, bringing lived experience into meetings, into planning processes, decision-making spaces, and not just as a one-off, but as a continuous practice. Our hope is what I've shared doesn't require you to start from scratch. It's really building on the strengths that already exist in your communities and centering the voices of older adults in every decision that your organization is making. We also believe these stories don't end here in this product or document. We at LSA are committed to weaving lived experience throughout all of our work. And I want to close this section by just saying this work is really possible because of partners who believe deeply that lived experience is expertise, and that aging policy and practice is only made excellence when we center that lived experience. So thank you to the SCAN Foundation for your partnership in this important and timely work. I'm going to pause here and move to our Q&A. And I see some notes in the chat. Thank you, Sarah Gentner, for putting in some responses there. I have one question already, actually, and it's for you, Petey. So I'm going to go to you first, but encourage folks, you can DM me directly as if you have, or you can put it in the main chat. Petey, what surprised you and the research team most about what you heard?
I think one of the most surprising things I heard was just around assets that people already own. This came up in one of the video segments from a LSA frontline staff, but many people had, expensive farming equipment that is broken or might not be used. And yet that's holding them back from getting, it's holding back their food stamp allowances. It's holding back their eligibility for Medicaid in some cases. So that wasn't something that I had heard before. I think also just some of the struggles of living in a really small, really remote town. I alluded earlier to the fact that there's just like one bus that goes in and out of the town every day. So if there's a few hundred people in that town, there was one restaurant, one grocery store, and a few motels. That's not enough jobs for 300 people. If you are able to get on the bus and find a job on the bus route, that's an option as well. But if you don't have a car, then, that bus is your only option, and it only comes once in the morning and once in the afternoon. So we've been to rural areas in most of the locations that we've traveled to. So like rural California near the Mexico border or rural Oregon. But this seemed to be like a different degree of rural challenges that felt a little bit more just the challenges felt more aggravated than in other locations.
That's very helpful. Narda, I have a question for you that has come in as well, which is the SCAN Foundation supports a lot of older adults' work. Are you planning to support more lived experience work?
I would say an enthusiastic yes. I think we really see it as, not just like a nice to have, but a critical component of the work that we do, and that it's not just like a point in time exercise. Actually, one of the things we really liked about the approach that the Public Policy Lab took on is that they had the foresight to really think about this as a longitudinal effort potentially. And so, the folks who are in the platform are potentially have consented to being reached out to again in later years. We also want to incorporate additional geographies. We also really hope that this goes beyond older adults. We see a lot of value in bringing in other populations and, welcome, funders and other folks who have other priority populations that they focus on to help us expand this work. We do really see it as critical. And I just saw Petey come off mute, so I'll see what he has to say too.
Yeah, and to expand that, some of those participants that we spoke with in Minnesota, North Dakota, South Dakota, we've already conducted additional research engagements with them. So there was a congressional hearing in Moorhead a few months ago that we were able to reach out to some of these participants and invite them to that hearing. And then just last week, one of the participants traveled to St. Louis, Missouri to speak at the National Association for Medicaid Directors annual summit, and she was able to talk directly with some of her state Medicaid officers and just tell them, face to face in person, some of the issues that she experiences as a Minnesotan on Medicaid.
Yeah, and to just expand on that
Yeah.
again, which is the other th really great value that we've been able to find with it is that we've been able to, as we are doing projects on other very specific policy topics. So, for example, we did a project last year around Medicare Advantage supplemental benefits, wanting to understand, absent the quantitative data about the utilization and access, we wanted to understand how people really interacted with these benefits, the extent to which it informed decisions they made about their coverage, the experience of using the benefits and how easy or difficult that was. And we were able to already go to our existing pool and identify a number of folks who we already knew were in these plans that offered these benefits and conduct additional research with them there. So
Mm.
it really is the gift that keeps on giving. And I hope that others on this call will continue to partner with us and with others to make sure that the person's voice is really at the center of all the policy work that we do.
That's great. Thank you. Another question that came through, and it doesn't say who it's for, but PD, I'm actually going to toss it to you because it's about what we heard. Do the older adults show an awareness of the cuts that are coming? Do they seem afraid?
I would say 100%. So
Yeah.
these trips to these states were part of our second round of research. We conducted the first round of research in it was like the end of 2023, beginning of 2024. Things were coming up then, but in this round, which we conducted primarily last spring and summer, it just came up in almost every interview, just fear around programs being cut, programs that people, have relied on, or in different state and federal programs that they've, you know, worked into and contributed to, and then there's just a really big fear about those things being pulled away. And when you're living on a fixed income and, maybe after rent and bills, you only have $100, $200 a month, if your food stamp allowance is getting decreased, that's a big portion of your budget. And we heard of older adults who couldn't afford light bulbs. So they were taking a light bulb from one room and then traveling around their house with that same light bulb. Or older adults forgoing using heat because in the winter they said I could only afford gas, food, or heat. So the first thing to go would be heat, and then you're sitting inside with, you know, 10 blankets on to stay warm in a very cold South Dakota winter.
Yeah. And I think it's very helpful that you remind us of that because I think there is sometimes a misconception that older adults are not aware of some of the policy and systems changes that are impacting them. And I think we saw very clearly that there's a real not just awareness, but desire to have their voices be heard around how to influence that. There's a question that came through the main chat to everyone from Elise Brown. How do we balance the need for planning for care and maintaining the family farm/ranch? I hate to sound harsh, but families need to think a little more in advance so they aren't facing selling the farm to cover the cost of care. So thinking about what kind of guidance and support families are receiving for their overall planning purposes. I'll just share that within the Rural Aging Action Network, RAN, and some of the organizations who are part of this webinar are in that, and certainly we're part of this project. I think that RAN is a vehicle for supporting organizations in educating families around how they can plan for issues like this. I think there's more work to be done there. Alicia, I'm not sure if there's any other insights you have from other older adults' work, but it also looks like, Lisa, you've shared some background on a program that could have some more information.
Our legislative agenda also has reference to this. It's a different circumstance.
Yeah.
It's complicated, like you say, but I think there's also, in terms of our agenda, recognizing that those assets aren't necessarily indicative of family assets.
Right. And we have a policy overview for our older adults work that we can circulate to all the registrants, so we can include that. Another question that has come through, this looks like it's for LSA. Does LSA do other lived experience work? Yes. Yes, we do. So across the Lutheran Services in America programs portfolio, so Lutheran Services in America has 300 organizations as part of our network in 1,400 communities, and serving 1 in 50 people in this country across the lifespan. So this conversation is obviously very focused on older adults. We also have organizations that are serving younger families, and also serving families that may be in the same community across that lifespan. So we have our Results Innovation Lab, which has very much prioritized centering family voice to influence practice and systems change. We are also launching an initiative called Transforming Together, in which 15 of our organizations across different populations, which is very exciting because it's not population specific, will be going through a human-centered design strategy to strengthen how they listen to families and people. We'll be building on lessons from this work, but ultimately, we see it as a core value that in order to develop and design really effective practices and policies, we need to be listening to the people who know how it affects them most, and that it not be, as I said earlier, one-off, but that you really build these practices in so they're part of a culture shift and a mindset shift for an organization. That's true for LSA as a national organization and how we work with those in community. Just looking to see if there are any other questions. It looks like we've gotten to all of the questions that were DM'd to me. And thank you for continuing the conversation, Lisa and Jacqueline. We will circle back with some of the resources that have been put into the chat, as well as some of what PD and Narda have shared. PD, I know the website that the People Say Project has been an enormously helpful resource to LSA, and I think we'll reshare it with all of you. As we close today's conversation, I just want to first say thank you, Narda and PD, for being here and for your partnership. And I think the two of you share the simple but powerful takeaway for us, which is really that better policy starts with listening. And we invite all of you to join us in advancing rural aging solutions that are grounded in those lived experiences. We see this product for LSA as a defining moment for us because it reflects the type of packaging and organization of these insights that we want to continue throughout our work. We know that rural older adults are not just navigating a single challenge, but really a convergence of pressures that impact their health, their housing, and their connection to community. We heard, as PD shared as well, administrative complexity is increasing, economic realities are shifting, and local care infrastructure is thinning. And we're really concerned that older adults too often fall through these cracks, not because they are ineligible for support, but because the systems meant to serve them are fragmented, outdated, and difficult to navigate. We don't see this as inevitable, and we share that with Scan and with PD and his colleagues. We think this is the result of choices, and that means they can be changed. So what does that mean for us and next steps? As I shared, we think each of us has a role to play in shaping what comes next. Whether you're a policymaker on this call, a funder, a provider, you have the opportunity to help modernize the Medicaid access process and strengthen home and community-based services, and also invest in trusted community-rooted models of care. We're committed to continuing to share our insights and lessons from this work as well. And we believe that's what's needed now is urgency, coordination, and commitment. So as you leave today, we encourage you to take one step forward, elevate these stories in your work, look for opportunities to simplify and strengthen the systems you influence, and think about how your organization is continuing to center lived experience in the decisions you make. So thank you so much for being part of this conversation, for the role you play in moving this work forward. Couple of next steps. You'll receive a follow-up email containing materials from today's webinar. As I mentioned, we'll have the recording, a link to the e-report, information on the People Say project, and the SCAM Foundation's policy brief series on aging in California. as well as contact information for those of us who spoke today. And we invite you to partner with us in advancing these solutions. You can reach out to me, to my colleague Reagan, and to others to continue the conversation. Before you hop off, we have one last poll question, which helps us continuously improve our work and strengthen, how we are communicating and operating with the field. So we ask you to answer that. And just thank you again to the SCAN Foundation, the Public Policy Lab, and the People Say. And thank you to the participants who shared their stories. Without their voice and their time, this work would clearly not be possible. And thanks to all of you, and have a great afternoon.